Women who want to give birth and have multiple uterine fibroids. How should they choose treatment? Uterine fibroids are like weeds growing in the ground. It is easy to regenerate. Therefore, any treatment that does not remove the uterus is likely to recur. But the womb is not land after all. Can't withstand our repeated harm. So when choosing treatment at the very beginning, be careful. Don't let the uterus injure repeatedly. Women who want to give birth and have multiple uterine fibroids. How should they choose treatment? Uterine fibroids may recur in any treatment that preserves the uterus. For multiple young women with fibroids, the chance of recurrence is even greater. Therefore, these women must consider the duration of treatment for pregnancy and the effect of uterine scars after treatment. A few days ago, a netizen asked me in a comment, I had laparoscopic treatment 10 months ago. Eliminate 3 fibroids. The largest 7 centimeters. But a few days ago, I went to check and found a 4 centimeters fibroids. Age to 8 years old. Want to give birth. What should I do? Regarding the situation of this netizen, if you get pregnant without treating uterine fibroids, the risk is high. The psychological burden is also heavy, and the risk of uterine rupture in pregnancy 10 months after laparoscopy also increases. Laparoscopic treatment again. Our uterus can't bear the harm either. And after laparoscopic treatment of uterine fibroids, it takes 1 to 2 years to get pregnant. During this period, fibroids are likely to recur again. Is it possible to continue the treatment? After weighing the pros and cons, I suggest that she can now consider ultrasound ablation treatment. Pregnant 3 to 6 months after ultrasound ablation. Try to get pregnant as soon as possible before the fibroids recur. My suggestion: for multiple fibroids, young patients, especially women with fertility requirements, ultrasound ablation can be the first choice for treatment. This method has less damage and shorter pregnancy preparation time after surgery. The treatment of not opening the uterus also avoids the possibility that pregnancy may cause uterine rupture. For women with fertility requirements, fibroids have recurred symptoms or have a heavy psychological burden. Can be treated again. There is no harm to the human body. Ultrasound ablation also has a major advantage for the recurrence of multiple uterine fibroids after treatment. After ultrasound ablation treatment of uterine fibroids, inactivated fibroids may have some inhibitory effects on new fibroids, similar to an in situ vaccine effect. Of course, this area needs further research. The treatment that suits you is the best treatment.